It is quite common. We have a lot of remissions in many patients. They will need, as Dr. Mesa said before, um, different bone marrow transplants. We can have as many as we need. We have also different types of chemotherapy drugs that we can use, but it is quite common and our unresponsive leukemia in chronic adults and in acute adults forms.
Yeah, basically it's a matter of persistence, I would say. Bone marrow transplant is one of those treatments, as Dr. Martinez mentioned, that we try to do again and again. Of course, it's not as easy as it sounds. I wish it would be like that, but of course, undergoing a bone marrow transplant, especially if you're 4-year-old, 5, 6, it's very, very, I mean, it's a very hard process. We would like to do it 4 or 5 times if the patient needs it, but of course, that is very, very difficult. We have to remember that basically we have to kill, in a certain way, all the immune system before actually putting a new one, which is basically what we do in the bone marrow transplant. So you are very prone to infections in the meantime, and unfortunately, some of our patients will have some of those infections and will die of that in the process of getting the cure. So being persistent and searching for the right transplant, the right donor, and the right cells is something that we do. Before we had so many, I mean, our possibilities were so limited that we had very few donors. Now we try to seek family members, we try to seek newborns, and actually we've heard of stories of families having children just to, or in a certain way, to help them with bone marrow transplants, just to harvest the blood cells of the umbilical cord or of that newborn baby, which which is, everything is a possibility in this when we're dealing with such a difficult condition as leukemia. Persistence, I would say, and that's the key. That's it.